This video is going to start looking at the female pelvic viscera. We'll have some additional videos looking at ultrasound, but right now we're going to focus on cross-sectional CT images of the female pelvis. So to start with, looking at some artist renderings of the structures that you'll see in the female pelvis. We're going to start with the upper image, which is actually lower in the pelvis relative to the image below. But we're going to start and just kind of work our way clockwise around. So first off, up in the upper right-hand corner, we can see the femoral artery and vein. Remember that like we talked about before, the vein should be somewhat darker and larger than the femoral artery. Then we can see the pubis and then the ischium with the acetabulum back here, and you can see the femoral head sitting within that acetabulum. You can also see the obturator internus muscle right here coming across or coming around. In the midline, we can appreciate a couple different structures. So first off, the rectum is located just anterior to the coccyx. So you can appreciate the coccyx back here. Just anterior to that is the rectovesical pouch of Douglas, or rectouterine pouch of Douglas rather. So that's what's labeled as cul-de-sac in this image. The blue here represents the vagina. The vaginal cavity can be usually seen in between the anterior and posterior vaginal walls. And then just anterior to that, you can appreciate the urinary bladder. Moving over this way, we can see the internal pudendal artery and vein sitting again within the pudendal canal on the medial surface of the obturator internus muscle. Moving more anteriorly, we can see the obturator foramen containing the obturator artery and vein. And then once again, we can see the sciatic nerve on either side. So you should be able to appreciate that quite well. And we'll see a good example of that here in one of the images. And then the sartorius muscle, so you can see various muscles within the anterior compartment of the thigh. So again, we'll just point that out here briefly, but realize that we'll be getting a lot more into the musculoskeletal anatomy of the lower extremity once we move into the extremity lectures. So that'll be on the musculoskeletal lectures. Moving to the image below, which again is actually at a higher level, because now we're looking at the level of the uterus versus this one looking at the level of the vagina. So again, we're a little bit higher up at this point. Remember that you have the peritoneum is going to be coming down and reflecting over the fundus of the uterus. So we're just below that level in this image. So looking at the images, we can see the inferior epigastric artery and vein like we saw and discussed in the male. Then moving back this way, we can see the external iliac artery and vein at this point. Moving back this way, we can see the location of the ovaries. So the ovaries are going to be located right next to the uterine tubes, so the fallopian tubes coming off of the uterus. So you can hopefully appreciate that located right here. And then coming off anteriorly, running within the broad ligament, is where you'll see the round ligament of the uterus located, again, kind of coming around this way towards the deep inguinal ring. And then ultimately that's going to go down and insert under the labia majora. Coming back this direction, you can see the ureters on both sides. So those are going to be coming down and eventually dumping into the bladder posterolaterally at the UVJ, so the uterovesical junction. So if we look at an example of this, we're going to start out by just mentioning the fact that this is a person who is quite obese. And so you can see the presence of what's called a panniculus. So this is going to be where the abdominal fat usually sort of drapes over the belt line. And so depending on the size of the person, you may or may not see a large panniculus. Just again, this individual, the size of their panniculus indicates that they're quite obese. Here we have the inferior epigastric vessels that are pointed out for you there. And then the external iliac vein and the external iliac artery. So again, you can see those on both sides here. Same thing with the inferior epigastrics. Then we have the uterus in the midline, and you can see how there's a sort of this darker central region that is going to be the endometrial cavity. So the uterine cavity, in other words. And then we have the ovaries located on either side of the uterus. And you can see how they're sort of like the testicles in the sense that they should have a relatively homogeneous appearance to them. And then finally, we have the gluteal vessels located back here. So you can see the gluteus minimus, medius, and maximus. And then this is going to be the rectum located right here in the midline. And this is the distal part of the sacrum. As we're descending here, so the next image down, you can now see the obturator vessels. So they're traveling in the obturator foramen. We can see the vagina here in the midline, so the vaginal cavity is black due to the fact that it's partially filled with air. The rectum is located just posterior to that, so you can see how there's just a very small amount of gas located in the rectum in this individual at this level. And then we can again appreciate the obturator internus muscle as it's exiting the pelvic cavity to then run out and eventually insert onto the femur. And then you can get a pretty good view here of the sciatic nerves. You can see that located right there. Now looking at some of the bony structures in this image, so this is quite high up in the pelvis. So we're actually looking at this point in the false pelvis. So we're up here, located in and around the iliac bones. And so up here you can also note the size of the abdominal fat layer in this individual. You can also see the rectus abdominis muscles on either side of the midline there. So down here, we can appreciate the SI joint, so the sacroiliac joint in between the sacrum and the ilium. And then right here, these two holes are representing the sacral foramina within the sacrum itself. All right, so we're going to continue descending. And so as we descend, you see the uterus here with the endometrial cavity in the midline. Again, you should hopefully note that these are the external iliac vein and artery. This is going to be the ilium, where you can see a little bit, not the bone, but the small intestine, which it's hyper intense because of the fact that this person was given a contrast agent, and so that contrast agent is present in the ilium at this point. You can also see the rectum back here posteriorly. Again, as we continue descending, you're seeing this is the bladder right here. You're seeing a fair amount of scattering up here. That's actually due to the presence likely of maybe a button on a pair of pants or something along those lines, but some kind of metal it looks like there that's causing that sort of diffraction of the X-ray beam as the scan was taken or obtained. And so as we are descending again, you can appreciate the vagina and then the rectum again. If you kind of follow this back up a ways, you just kind of keep an eye on the location of the rectum the whole way. So again, as we continue descending, you can see the amount of gas that's present there, and then it sort of disappears down this way. But now you're able to see the vaginal canal. So up here, this would be vagina versus rectum. And then as we continue inferiorly going back down, here we see the obturator internus muscles once again. And then you can see the pubic symphysis up here anteriorly. And then the sciatic nerve right over here on either side. You can appreciate that nerve quite well. And then finally we have the levator ani muscle, which you can also appreciate quite well in this individual. And then right here, this is the ischium and the ischial tuberosities that you're seeing on either side right there. And then that's going to be the last image of that series. So at this level, you can see where we're down at the proximal part of the femur at this level. So this is just an interesting case related to the genitourinary system. So this is an example. You'll notice in the midline this sort of abnormal structure that's appearing in this person. So this is actually an example of a horseshoe kidney. So you can see where the left and right kidneys are attached here in the midline. And so that obviously would be a congenital abnormality that is relatively rare, but it does come up sometimes. And so it's good to be aware of the fact that sometimes those kidneys can be attached like that. This is another example of an abnormal kidney. So you'll notice on the patient's right that they clearly have this enlarged renal pelvis and proximal part of the ureter relative to the contralateral side. And so as we descend, you'll want to keep an eye on the ureters on either side. So here you can see it on the left, and here it is on the right. And so the size on the right patient's right of the ureter is approximately double the size it is on the left. And so again, that's indicative of a likely renal calculus located somewhere along the course of the ureters. And so here these arrows are just pointing out again the difference in size between the left and right ureters, which is, again, it is quite substantial, quite noticeable that the right one is much larger than the one on the right, or sorry, on the left. So the right ureter much larger than the left ureter. So here we have another image that's showing us an abnormality related to the kidneys and the ureter. So in this case, you'll notice that we're at the level where you can appreciate the liver, you can appreciate the left kidney, but you're not seeing the right kidney. So if we go down a little bit further, now we're in the false pelvis. So you can see the ilium or iliac bones on either side, sacrum in the midline, and then notice that there's this ectopic kidney that's located way down in the pelvis in this patient. Here's another abnormality in a female pelvis. So we can see that there's this abnormality that in the left anterior quadrant of the pelvis. And so on conventional radiography, it's relatively difficult to tell exactly what that is. But if you look at it on a cross-sectional CT scan, you can appreciate much better what it is that you're looking at. And so this is an example of a uterine fibroid or uterine leiomyoma.